Namaste everyone. Welcome to the launch of the specialist services in Saath, included with a discussion on the future of telemedicine. We are joined by some of the most prominent speakers, and we are just beginning with a quick video on what we have done with the project so far, and then we will begin a heavy round of discussions with all our esteemed guests and partners. Ashleen, please continue with the video. Ashleen, the audio is not here. If you can just also include the audio while you screen share.
Your partner, Siva International. In Delhi NCR, in Haryana. When this pandemic was happening, we at Extra thought how we can help and what role we can play. One thing which is a reality today is virtual care. AXA launched a toll-free number with NGO partner Siva International in Delhi NCR, in Haryana, in Maharashtra, and in Rajasthan. And this free service gives access to medical support 24/7.
फ्री टेली कंसल्टेशन के थ्रू रूरल मोस्ट पब्लिक को रीच करें और उनको मेडिकली हेल्प करने की कोशिश करें एज मच एज पॉसिबल। अब टेली कम्युनिकेशन और टेली कंसल्टेशन ने बहुत ही बड़ा रोल प्ले करा है,
reaching to the rural area as well as the educated people through the telecommunication.
And during this pandemic, Seva came as one of the key NGOs which was helping people both in getting medicine and information when the beds are available. So we decided to partner with Seva to launch it.
But week of COVID-19, we realized how far when they were ill or sick. It was then we realized that India's complex public health problem cannot be solved in the mode of just expanding the physical centers. The need for a digital solution was imperative. It was then we launched Saath, a free doctor service which allows one to connect with an experienced medical professional with a simple dial from their phones. The service is so simple that even a kid or someone who is a senior citizen can use it effectively and get the benefit of a guided medical consultation.
The telemedicine platform has been designed by Hobbs Healthcare, and it has been modified by the project designed by EXA France and Seva International. Currently, the project is offering the services of allopathic doctors alongside Ayurvedic practitioners and nutritionists. Soon, we are planning to launch the specialist services as well, with which we can provide the services of gynecologists, dermatologists, orthopaedician, pediatrician to the people who don't have accessibility to such services and they need to travel to a big center or a proper city area to get this kind of a quality services.
हम लोग जो है इनको अवेयर करेंगे जाके, जैसा आप देख रहे हैं कि इस कॉलोनी में आज सभी को अवेयर किया गया है और लोगों को डॉक्टर से बात करा के उनको प्रिस्क्रिप्शन दिलाई गई है। बहुत लोगों ने इसके प्रिस्क्रिप्शन से जो है ट्रीटमेंट शुरू किया और उनके अच्छे रिजल्ट आए। उसके बाद उन लोगों की ये खास तौर से डिमांड थी कि जी आप इसको, हमें बहुत बेनिफिट हुआ और हम चाहते हैं कि आप इस बेनिफिट को और ज्यादा दूर दूर तक लेके जाएं।
मैं सुनील शर्मा गांधीनगर गुड़गांव का निवासी हूँ। तो मुझे बीते 4 दिन पहले थोड़ी सी खांसी की जुकाम की शिकायत हुई, तो मैं हॉस्पिटल में जाना चाहता था, लेकिन हॉस्पिटल में थोड़ा सा डर है कि आजकल जो कोरोना की वेव चली हुई है इसके अंदर बहुत ही ज्यादा रिस्ट्रिक्शंस हैं और है। तो इसलिए मेरे किसी साथी ने साथ का नाम बताया जो कि टेलीकॉलिंग पे आपको डिस्क्रिप्शन देती है। मैंने डॉक्टर साहब को अपना सारा का सारा बताया, तो उन्होंने मेरा सारा का सारा जाना कि खांसी कितनी आ रही है, जुकाम कितना है, थर्मामीटर से उन्होंने चेक भी करवाया जो कि मेरे पास अपने घर पे था। उन्होंने बुखार वगैरह सारा ट्रीटमेंट चेक करके 10 मिनट सारी डिटेल मुझे डिस्क्रिप्शन लिख के उन्होंने मेडिसिन दी। तो इससे मैं बहुत ही प्रभावित हुआ और अपने सभी पड़ोसियों को, यार दोस्तों को ये उनको कहूँगा कि वो भी टेलीकॉलिंग का फायदा उठाएं। और ये बहुत अच्छी संस्था है जो कि हमारे वर्क साथियों के लिए और जो परिवार डॉक्टरों को अफोर्ड नहीं कर सकते इसके लिए बहुत ही सुविधाजनक और ये साथ बहुत अच्छा कार्यक्रम चला रही है।
Most of the people who are living in slum areas, they do not have money to eat at least one time of food. In that thing, we give a hope to those people also, those who are at contract labor workers working at construction sites, those who are living in slums area. We people are reaching to them. We do have a volunteer also working for our Saath organization. Those volunteer people are going to the peripheries areas, the slum areas. They are gathering the people who literally have problems, health issues. They people are directly contacting those people to us, and we people are treating them via teleconsultation. And I have been working on this project for a long time, and I have almost treated like more than 1,500 patients yet now. And let me tell you, in short period of span, in the short period of time, it wouldn't have been possible to treat many of the patients without this service.
So availability and accessibility to the best of medical consultation, also personalized consultation without having to spend a penny is, I think, what should be told everybody as the hallmark of this knowledge. And as was being mentioned, this is countrywide, that you have actually become pioneers by launching one of the first of its kind, countrywide free telemedicine facility, Mark Seva Divas.
And this is all possible just because of our telecommunication, or I think there is a great future of telecommunication.
Saath is reaching each and every person.
हमें job satisfaction मिलता है.
We can soon expand the services to other states of India and give the benefits to the free teleconsultation services to the people residing on those states as well.
This unit is there to continue to support vulnerable communities, provide a free service and a confidential service. We are very happy to be part of Saath and to be working with Seva International.
So, namaste and welcome everyone to this special session on discussing the future of telemedicine and for the launch of the specialist services at Saath. I'd request Sri Cham Parandiji, the Secretary at Seva International, and our Honorable Trustee to please share a welcome note to begin the session.
I welcome you all to this very special session on telemedicine that Seva International had launched a couple of months earlier and is being supported by AXA Insurance and has successfully run for last couple of months. Seva International, since its inception in 1993, has been engaged in serving the society selflessly within India, within Bharat, as well as globally. This is supported by Indian diaspora, which is the most vibrant diaspora spread across the world. And the diaspora serves local communities wherever they be, and also support good non-governmental organizations, voluntary organizations across Bharat, especially during the disasters or even for long time rehabilitation and long time regular service activities. Presently, Seva International is working in 26 countries and has supported more than 250 organizations in Bharat. And this effort continues. I am glad to inform you that today we'll have a very good session, and I welcome the panel, Dr. V.K. Paul ji, Vinod Kumar Paul ji, member Niti Aayog, and who has worked tirelessly during the COVID that affected Bharat last year, and Dr. Anurag Mairal ji from California, and both are the alumni of Stanford University, and Dr. Anurag Mairal ji still continues to be a professor there. We also have Dr. Dhananjay Sakdev, who had been serving tribal community in Kerala and is awarded Padma Shri this year, and also Dr. Sanjay Singh ji from All India Medical Sciences, who of course led the team of All India Medical Sciences during the COVID operations. Seva International had served in a big way last year in Bharat during the COVID, and thus, as a part of that extended part of that program, we started the launch, and today is the launch for expert doctors to join. I welcome you all again, and thank you, and thank our guests, especially Dr. V.K. Paul. Dhanyavad, namaskar.
I would request Nishanti from our team share a quick note on what we have been doing with our telemedicine service, Saath, and begin the discussion.
Namaskar. Very warm welcome to all the respected dignitaries, doctors, and friends who have joined this soft launch of specialist services to our Saath telemedicine platform. We are all reminiscent of the havoc unleashed by the Delta variant some 10 months ago, which resulted in lakhs of fatalities. It was during then that we launched our digital portal for emergency services, covidseva.com. It was an instant success when more than 44,000 people visited it within the first few days. And we learned an important lesson there, that India is accepting digital solutions to daily problems. It was then that the Saath was envisioned with our CSR partner, the AXA Group, who has willingly come and supported us in this endeavor. In India, creating one-size-fits-all program is always challenging considering the diversity of India. Hence, we launched Saath as a pilot project in 4 states of Delhi NCR, Haryana, Rajasthan, and Maharashtra last year. In just the last 100 days of service, we have had more than 12,000 patients from almost 100 districts so far. The number of patients is also increasing by around 20% every month and is also contributing to the behavioral shift of the people. Today, we are introducing the specialist services like gynecologist, pediatrician, dermatologist, orthopedics, and we are humbled by the presence of eminent panelists, not only from India, but from across the globe, who are joining us on the occasion to discuss the future of telemedicine in India and also join us on the mission of solving India's public health problems together. We welcome you all. Namaskar.
Thank you, Nishanji. When we imagined this service, as Nishanji mentioned, it was imperative that we would need support. The support came heavily in the form of the EXA group coming together as one EXA and joining our hands together in launching and running the service. We have the pleasure to welcome Dr. Alfred Dale, who is the Chief Medical Officer of the EXA group. And in the last 24 years of work, he has been now heading the claims at the EXA group. With a medical degree and a PhD in cancer research, we are privileged to have you, Dr. Alfred, and look forward to listening to you.
Thank you so much. And first of all, thank you so much for having me for this exciting event. And I must say, I'm absolutely supportive of what you are doing in India. And I'm absolutely proud that AXA is part of this exciting story. I would like to highlight that I think that we need to deliver care which is absolutely tailored to the resource situation in a country. And of course, as already mentioned, yeah, so previously, India is in a very special situation just because of its size, its magnitude, and its variety of different situations. I think, especially in rural areas, access to qualified healthcare is often difficult or even impossible, but certainly not only in rural areas, also in the big metropoles, I think access to healthcare can be very difficult. And we just saw it during the COVID situation that delivering remote services can replace to a big extent a physical interaction, or let's say a more on-site face-to-face interaction. So I am convinced we need technology to reach out to underserved communities and to make it easier to get access to qualified health service. So, and telemedicine, of course, is offering a perfect opportunity. I would like to highlight the value for prevention, because prevention is something which is quite often underestimated, but prevention is not only doing good for the people, it is also very beneficial for the overall situation of a healthcare system, because it prevents situations from becoming more serious and more costly finally. Just let me give you the example of skin cancer. By the way, skin cancer is on the rise in India. There are 3 different types. Interestingly, the least common is the most deadly one. It is melanoma. And melanoma can be very well detected just by inspection from an educated person. And this can be done remotely in a very well way. So through visual examination of the skin, melanoma can be detected, and the next measure can be defined and be decided on. And this is because melanoma shows characteristics like typical color changes or characteristics of the shape. And now the good thing, in case of doubt, we can do follow-up exams much more frequently than previously, because there is no need to go on site into a different city or different facility or to the other part of the city. So we can do follow-up exams much more frequently. And so we avoid unnecessary surgery just because logistics are difficult to see a qualified person more regularly. On the other hand, more early detection and more timely removal is possible because of this low barrier access to healthcare. And this eventually will save life. So to conclude, I'm absolutely proud and happy to be part of the story. And in the future also, I'm happy to support this activity in India. And I'm curious to listen to the next interventions of the other speakers. Thank you for having me once again.
Thank you, Dr. Alfred. any big idea needs people who are passionate about it and people who are willing to go the extra mile to support it. We're glad to have the AXA group supporting and standing with us to help us smoothly run the service and be of help to the masses of India. Thank you, Dr. Alfred, for being with us. We have the next speaker who is someone I have looked up to from the last 10 years. I have heard and read about public policy. Dr. Vineet K. Paul is a globally recognized medical scientist. It does not require me to say that with an extensive medical background, he is currently a member of the Niti Aayog. I personally know and revere Dr. V.K. Paul from the Ayushman Bharat Yojana. A lot of my family members have benefited from it. In the last few months of my visits across all our projects, I have seen Ayushman Bharat Health and Wellness Centers being very well implemented in the PHCs, especially in the states of UP and Gujarat. And the Poshan Abhiyan is a milestone in India's journey in public health. He has also been a part of the digital missions on public health and especially on Ayushman Bharat digital mission. And it's a pleasure for having him today. He would be joining us to talk about the digitizing of public healthcare in India and the challenges and opportunities it offers to us. Look forward to listening to you, Dr. V.K. Paul.
Thank you, Kumar. Respected Shri Shyam Parandeji, Dr. Alfred Bell, Dr. Dhananjay Sagyoji, my colleague Dr. Sanjay Rai-ji, distinguished colleague Dr. Anurag Mehral-ji, the Seva International family, invitees, friends. I'm grateful to you for the opportunity given to me to be a part of this event today. A very noble cause being scaled up by the Seva team. It's heartwarming, the mission that you have crafted for yourself to be taken up with the help of partners. It's truly heartwarming. Helping individuals in their home settings with healthcare counseling, healthcare messaging, healthcare advice, prescription is a profoundly noble work. Telemedicine has emerged as a way of life in the context of COVID-19 pandemic across the world, but particularly so in India. There was a situational problem with regard to scaling up and legitimize and implementing legitimate ways of telemedicine till not so long ago. And it is the corona pandemic that has pushed to a totally different level. And I have a personal connect, which I just want to bring in here with this whole movement. I was part of the board of governors, chairing the board of governors of the Medical Council of India, and was interacting with stakeholders who wanted to see telemedicine going leaps and bounds. And we discovered that the legal framework for telemedicine in India was weak, if not a hurdle. A particular high court, honorable high court, had questioned advice being given on the phone and the consequences or lack thereof. There was no legal framework. And using my Niti, convening capability, talk to people, was wondering how to have legal, legitimate telemedicine in India. And what it means is that it is an activity which protects the doctor. It protects the trust between the doctor and the patient. And the patient has a say. Patient has his or her rights, and the patient is at the heart and at the center of this interaction. The way that we, after discussion, emerged was to incorporate telemedicine in a legal framework under the Medical Council of India Act, now the National Mission paradigm, in which the ethics paradigm within that, the ethics domain within the Medical Council of India, Indian Medical Council Act, provides a framework for doctor-patient interaction along agreed guidelines, along ethical guidelines, legitimate guidelines, because it's a professional interaction. And we worked on it in the Board of Governors, and NITI team, my team on this end, helped us to bring together the best practices from the world. And we created what we then called as telemedicine guidelines under the ethics domain of the Indian Medical Council Act. So we provided that framework. It took about 5 to 6 months, deep consultations. But then it, almost when it was ready, within 2-3 weeks of it being really ready, came Corona. And the decision for a national response to this. And within 2 days of the national lockdown in March 2020, since everything was ready, it became a norm, it was promulgated, it was gazetted, and it provided a framework. Now, the movement of telemedicine in Corona would have happened in any case, perhaps, but then having got a framework which gives the guidelines within which the doctor-patient interaction takes place has been hugely helpful. And I'm very glad that this work of the Board of Governors came handy. And that's a very direct personal connect that I would like to bring to your attention in the movement, the revolution of telemedicine. The big development in regard to telemedicine is the Aishwarya Bharat digital mission. The key objectives of that mission include telemedicine. Other key objectives are directories of providers and facilities and individual health record and so on and so forth. But one of the pillars of Aishwarya Bharat digital mission is telemedicine. So then the legal framework, the capacity, and then a way to promote this across the country in a mission mode is the opportunity that came up through the digital mission, which was launched formally last year. So several things have come together, but the fact remains that it became a movement by itself in the context of COVID-19 by the people who had the need and by providers who were ready to be there to provide inputs, provide advice, counseling, guidance to their fellow brethren and sisters. The government of India rose to the occasion in multiple ways. One of the activity that the government undertook was the creation of e-Sanjeevani system for telemedicine, which is being a good and a robust and a comprehensive framework available to people of India for teleconsultation, particularly again in the wake of the COVID-19 pandemic. So in that context, I'm so delighted to see a voluntary effort by Seva International. It's remarkable. It's absolutely remarkable. There have been others who have volunteered their time, including Indian Medical Association, other NGOs, and so on. But I think to do the way you have done very systematically, connected with people, is remarkable. And I compliment you for the work that you have done. And the participation of your partners from the profession, from the corporate, the Alexa and the AXA group and their partners, remarkable. Bringing together stakeholders to deliver on a very lofty cause, highly remarkable. I compliment you for creating this model, for creating this possibility for people. The telemedicine is bound to only go the increasing way in times to come. This will be the way of life This will be the new normal for sure. And why not? Because up to a point, care, conversation, counseling, assessment, advice, prescription is possible without having to be in personal, in real time, in-person consultation. It's possible. It's not the end all and be all for sure, and it will not replace the formal consultation between the doctor and the patient. It will not. It cannot. It should not, because there are limits when you are reaching through any medium. As we know the medium today, tomorrow it may be even better reality, and maybe the frontiers would be pushed further. But why not? A, it is convenient. B, you don't have to spend money out of your pocket to travel. It's a out-of-pocket expense to have for a 15 minutes consultation to spend half a day, if not the full day, losing your wage. Not worth it. And then if you break down the telemedicine in different ways, for a routine follow-up for an epilepsy child, where the questions that you ask are essentially, is the epilepsy well controlled? Did we find anything unusual? And then you're saying, okay, continue until, Dilantin or chlorpromazine for the next 3 months. Why should it become a costly affair? So there are very spontaneous possibilities. There's spontaneous possibilities in diabetes, in chronic diseases in particular, mental health in particular. And I want to emphasize the potential also in geriatric health in particular. I think that's one less visible part, but waiting to be standardized. Because old people, my father, not easy to mobilize him to come to the hospital. It's not always as practical as it would be for another age group. Difficulty in transportation, etc., etc. And then often the problems are simple. Often the problems are about talking and counseling and reassuring and guiding. And often the problems are around the very core of primary health and nutrition. It's about food. It's about hygiene. It's about that little, lesion which is itching on the leg, which doesn't need rocket science. It just needs a way of looking after. But then it's huge issue for that person at that particular age. It will happen to all of us. So I think one particular area, other than every other area, is truly the care of the elderly. Mental health in its own way has been talked about in public domain. I will not touch. But it does go beyond that. It goes to the specialists. And I'm so happy that you are now bringing in the specialty care into this paradigm. My 2 bits of advice are following. One advice is scale up, get more partners, increase footprint, get the satisfaction noted from the recipients. That's one part. The second part is to highlight the fact that patients want to see the same doctor. Conversely, they want to hear the voice of the same doctor whom I talk. One complication in telemedicine happens to be that in some systems or usual systems, there is somebody else who's picking up the phone on the other side next time. That's not done. The fundamental tenet of health professionals' involvement is follow-up. Of course, the patient chooses the place where to go. And of course, in a tertiary care setting, often it is a team. But I want to see the same team. I want to see the same lead doctor, same nurse, and so on. And therefore, please keep in mind this need which you and I experience in any case. It's something spontaneous. It's not every time a different person. So can a way be devised along that? The second part is to have treatment that is standardized in the sense that it should follow evidence-based standard practices. It should do the right things. It should not over-prescribe, for example, or over-advise in terms of investigation. It, on the other hand, should not be trivial. It should be subnormal. So it should not be so minimal that it doesn't meet the requirement of the patient. So have the right balance, which would mean that if you're going to go deep into it, devise ways how you would like to do. In a normal world, the physician himself or herself decides it, which is fine, so long as then it is the same physician who is interacting with the patient. But if there are different people going to talk different things, then the broad bandwidth of our advice must be standardized. Messages can be even written. And if you are going to involve other professionals, for example, in the team, if you have a counselor, a dietitian, nurse, and why not? Because they augment the work of a health professional, part of the team, then it will be even more important that there is a clear translation of what the messages are going to be and what the don'ts are, what the things that the patient should not do and what that person I should not do or say. For example, in the corona period, at this particular point in time, the doctor should really not prescribe ivermectin or hydroxychloroquine. It will not be the right thing to do. 7 months ago, it was fine. So not done. Similarly, to counsel in the context of Omicron in some ways is different than what it was last year in the middle of the year. So it should change. Similarly, antihypertensive therapy, the first line it has to be the first line. The first line cannot be the seventh line. So there has to be, because it will bring in discredit and also open up, because it will be recorded, visible to other people, and so on, opens up to issues around practice and ethics thereof. So I urge you to create that personalized care as much as possible. That will help. B, standardized, remain within the overall ambit of standard therapy, which emphasizes rehabilitation, follow-up, and also emphasizes prevention. And the messages are answered, they're polite, and all the good things that we talk about between doctor-patient relationship of how caring, tone, voice, connect has to be ensured must also be part of the telemedicine interaction. I'm very happy to be here, and thank you very much for allowing me this conversation, which I hope will go on to your colleagues of the team. Thank you so much.
Thank you, Dr. Vinod Paul. As a mentor, as someone who has guided us and advised us for so long, it's imperative that we would really we are looking forward to your suggestions, and I'm glad that we will be able to incorporate some of this in the way we scale up and see this initiative in the future. As you mentioned, and as our discussion has been scheduled, today we have a special day in which we are launching the specialist services as part of our offerings. In the last few months, when we have met patients and we have interacted with them, this can come from the tribal areas of Palghar or the cities of Haryana. In any of these locations, one constant idea has been that I have this problem for many months or many years now. What do I do about it? I never thought about consulting a doctor, either because of distances, as you mentioned, or because of just access. They don't know how to go to a doctor and they don't want to make that expenditure. We discussed this and felt that specialist services might be a good addition to the service. We have added slots of each specialist doctor in which you can schedule a call and talk to the doctor. So Vicky Paulji would just request you to launch the service as anyone else would do, and dial up the number, which is the number which is for this consultation, and talk to our doctor as our launch event.
Welcome to Saath.
So I have dialed the number already.
आपका स्वागत है. Please press 1 for English. हिंदी के लिए कृपया 2 दबाएं. कृपया विकल्पों को ध्यान से सुनें और अपनी आवश्यकता के विकल्पों को चुनें. डॉक्टर से कंसल्टेशन के लिए 1 दबाएं. You are number 1. हमारे साथ बने रहने के लिए आपका स्वागत है. मैं आपकी क्या सहायता कर सकती हूँ?
थैंक यू वेरी मच. मेरा नाम विनोद पॉल है. मैं दिल्ली से बात कर रहा हूँ. कौन बोल रहे हैं? आप हाँ हाँ बोलिए। साथ प्रोग्राम में मैं जुड़ गया हूँ आपके साथ, बहुत बधाई हो, बहुत अच्छा काम कर रहे हैं आप। अब बताइए, आप आगे पूछिए मेरे से, आप क्या पूछना चाह रहे हैं।
आगे बढ़ने से पहले सर मैं आपको बता दूं, आपकी जो कॉल है वो ट्रेनिंग एंड क्वालिटी पर्पस के लिए रिकॉर्ड की जा रही है।
ओके, प्लीज कीप रिकॉर्डिंग एंड कीप इम्प्रूविंग।
जी सर, मैं आपकी बात डॉक्टर से करवा देती हूँ। आप मुझे अपना नाम बताइए।
मेरा नाम विनोद।
विनोद पॉल। आपकी एज क्या है सर?
एज है 65।
लाइन पर बने रहिएगा सर, मैं आपका कॉल डॉक्टर को ट्रांसफर कर रही हूँ।
ठीक है, वेलकम, थैंक यू। इट्स वर्किंग कुमार।
यस सर।
थोड़ा और बात करते हैं, डॉक्टर तक पहुंचते हैं।
जी जी।
You are number 1. Thank you for.
नमस्कार, मैं साथ की तरफ से डॉक्टर वीरेंद्र बात कर रहा हूँ।
डॉक्टर वीरेंद्र, थैंक यू वेरी मच। आई एम प्लीज्ड टू कनेक्ट विद यू। माय नेम इज विनोद पॉल।
हाँ जी, नमस्ते सर। वी हैव स्पेशल सर्विसेज अवेलेबल विद अस।
मुझे
ऑर्थोपेडिक,
हाँ
पीडियाट्रिक, गायनेकोलॉजिस्ट एंड डर्मेटोलॉजिस्ट।
पीडियाट्रिक ऑर्थोपेडिक से बात करा दीजिए।
ऑर्थोपेडिक से? हाँ जी सर।
जी,
अब लाइन पे बने रहिएगा।
मैं लाइन पे बना हूँ।
So this is the layer that we have kept for the specialist services, sir, so
Good.
that not all call transfers. The general physician will diagnose and take basic notes, and these notes will get transferred to the orthopedic doctor as well, or the any specialist.
Okay, fair enough then.
ऑर्थोपेडिक डॉक्टर हमारे पास ट्यूसडेज एंड वेडनेसडेज को अवेलेबल रहते हैं 5
ठीक
to 6 में।
ठीक है, वो डॉक्टर साहब ट्यूसडे और वेडनेसडे को 5 to 6 होते हैं, तो उस दिन कॉल करेंगे। बहुत धन्यवाद डॉक्टर साहब, थैंक यू सो मच। टेक केयर, गॉड ब्लेस यू। हाँ कर दीजिएगा, कंप्लेंट बुक करके ये कुमार जी को बता देना, शुभम को, तो वो मेरे साथ कॉन्टेक्ट कर देंगे। थैंक यू सो मच, बाय। So I'm very pleased to have inaugurated the specialist services of Seva International Telemedicine Mission. Thank you so much for the opportunity.
Thank you so much, sir. Our next speaker is not new to the Seva ecosystem. Dr. Anurag Mairal was with us in the COVID pandemic. The entire duration, we had very regular calls on discussing how to provide the best services at the time when the pandemic was at peak. Resources were limited, team was limited, a lot of constraints were alongside. And Dr. Anurag Mairal was always just a call away. With different time zones, I had pinged him late in the night, I had pinged him early in the morning, and he was always available and ready to provide service. His specialization is on the juncture of technology and medical sciences, and that's his topic for today. He's going to talk about the role of technology in public health, and it's a pleasure to welcome Dr. Anurag Mairal to this entire discussion.
Well, dhanyawad, Kumarji, and what a joy and an honor to be here. I've known Dr. Paul for over 14 years now. He was a key mentor for our Stanford India Biodesign program that I was part of since the founding. And that program has really flourished, and thanks to his guidance, and now in his role at Niti Aayog, he's furthering health technology innovation in India. And I'm really grateful to all the panelists and guests who are here for this opportunity, and congratulations to Seva for India, Seva Bharat for launching this service along with AXA. What I'm going to share today is just a few slides that really outline the challenge that we have in terms of providing care to a broad cross-section of the society, and the role that technology can play. As Kumarji said, I sit at the intersection of technology and health. I'm a fellow at school Center for Global Health and Center for Biodesign. I will not go deep into the technology area, which I would love to, but I won't today because I know other speakers are going to go into it. What I'm going to do is share the perspective of why technology is critical, and what the Saath program is a good example of the role of technology in providing access to care that would otherwise be very difficult to do. I'm just going to move this out of the way here. Hopefully you can see the slides. There you go. So before I get into some of the rationale for why we need technology in public health and what role it can play, let me just talk about what happened during the pandemic. This is a slide I put together for my global health class at Stanford, which has students from engineering school, medical school, and business school. And I had put this up in February of 2020, and I said, these are the things that we would need. I did not have PPEs at that time, and I did not have the ICUs and ventilators at that time, because we didn't know that we were going to have such a big shortage of it. But essentially, if you look at the list, all of these have been our technologies that have been very, very critical for this major public health crisis, not just in India, not just in the US, but around the world. And I've specifically pointed out two areas where telecommunications and smartphones and mobile phones and video conferencing can play a significant role. And especially I want to point out the penultimate, the last but one bullet point here, telemedicine for COVID and non-COVID patients. During as Kumarji was mentioning, last year, we had a telemedicine support for patients and their families that were going through the second wave crisis. But one area that most folks didn't really pay as much attention to, because we just didn't have the ability to pay attention to that, was the non-COVID patients. There were a lot of patients who were having heart attack or stroke, or they were going to give birth to babies. Those also got impacted during that crisis. And throughout this pandemic, that has been the case. At Stanford, for example, there have been 3 times that we actually canceled all non-essential surgical procedures during the peaks of the pandemic, and that has had a major impact. In situations like that, telemedicine has come really very handy. And last year, the number that I saw reported was there were 1 billion telemedicine transactions around the world, which is a billion with a B. What that means is that there is an opportunity to engage with the patients, engage with their families through telemedicine in ways that we had not thought about before. Telemedicine has been around for a while. In fact, the first telemedicine graphic was put together in 1929 in one of the publications. And then 1960s and 70s, there were some video mediated care that was provided in some parts of the US, but it took all these years to really get to a point where telemedicine would really play a role. The other thing I wanted to point out is that, globally, there is this perception that our disease burdens are very monodispersed in LMIC settings, and same as in developed world settings, high-income settings, and they are different. So infectious diseases in the LMIC settings and lifestyle diseases in the high-income settings. And it turns out that, in fact, there's a confluence of conditions that both the regions, both LMIC and HIC regions, actually are dealing with. Heart disease and stroke and other conditions like that have become quite important. And honestly, the care that we need to provide to the patients in all regions, and including in LMIC regions, especially in India, actually needs to take that into account. The access to healthcare in a country like India or any other middle income or low income country is really determined by the economic pyramid, right? A large percentage of our population earns less than 10,000, has wealth less than $10,000, and and if you look at the graphic on the right side, that really shows the structure of the healthcare system. In fact, where the care that is provided in the community health services to ASHA workers and so on, and A&Ms is accessible to the broadest cross section of the society. And then as you go more and more urban, you start getting access to secondary care or tertiary care. And in fact, that is how the referral system is set up. What happened during the COVID second wave last year, the Delta wave, was that there was a panic pandemic where a lot of people actually skipped a lot of primary care settings and came straight to these advanced care settings. And not only was that not needed, it actually really broke the system. And as a result, a lot of people that didn't need to die actually died. And the role that Seva played last year and other organizations like Seva that had telemedicine support actually helped mediate some of that burden. But the hope is that as we go look to the future, that sort of a system could actually help with other conditions as well. It's not just in an infectious disease pandemic sort of time frame. What I wanted to show in this slide was there is a gap in investment in public health. If you look at all the major economies, the investment per capita in terms of the health is pretty high for countries like United States, Germany, and so on. And then China and India fall to the bottom of it, and for a good reason. These are very large countries, and there's been traditionally underinvestment for decades because of the economic capacity in these countries. And when you look to the right, where this is the US data, which shows where most of those dollars go, they go towards hospitals, doctors, and then drugs and home care and medical equipment is part of that as well. Hospitals and doctors are high cost, long timeline items. It takes a lot of investment to build big hospitals. It takes a lot of investment to train doctors and deploy them across a region. And there's a good reason why so much of investment goes into it. The question, though, is that, and this slide on the left side, this visual actually shows the outcome per unit cost. And if you look at how the life expectancy on the y-axis actually keeps on going up as your investment goes up, but it starts to plateau. And then US is actually an inefficient healthcare system where the spend is out of charts, out of sort of scale, and yet the outcomes are not as good as, let's say, in Singapore and other countries. India and China, this is old data, and numbers are better today, but it's not dramatically better, right? Actually are at a lower end of that chart. The question that we should ask ourselves is, do we need to spend the kind of money that the US spends to get the outcomes that we need? And the answer is, even if we wanted to, we couldn't, because it is gonna be super expensive for a country of India's size. I think China has recognized this, India has recognized this. And I think the point that leads to is that we need technology to bend the cost outcome curve. Technology innovation that allows us to serve the primary care settings as effectively as you would serve a primary care setting in developed world. And telemedicine and other technologies of the kind that Stanford India Biodesign, School of International Biodesign in India, the whole India Biodesign community has been working on, could actually bend that cost outcome curve. You could have these really simple, but in fact, very effective devices and effective telemedicine solutions that allow you to do certain things in primary care settings in conjunction with something that sits at a major city through the telemedicine platform and through some sort of connection between expertise elsewhere and locally trained talent that can do basic triaging. So that's really the promise of technology, and it's as much a requirement for a country like India to do that as it is an opportunity to change the paradigm in providing public health access at a lower cost and a better outcome. I'm just going to end with this slide, and Dr. Paul would recognize the phrase here, India Biodesign. One of the earliest groups of innovators in the India Biodesign community actually were mentored by Dr. Paul and his colleagues, and they have come out with some really remarkable technologies that can actually bring neonatal resuscitation at a very high quality to nurses and A&Ms in remote settings, for example, right? Hearing screening that can go into the last mile. And I think this is the promise. India is probably the second or third largest innovation ecosystem around health technology right now. Maybe in at least definitely in top 5, but in some ways I would consider it to be number two or number three in terms of new ideas and the generation that's involved in innovation. And my hope is that plugs into the initiatives like Saath, so that access to the technologies, these innovative technologies, can get to the last mile in the primary and secondary care settings in tier 2, tier 3 cities, as well as in rural areas. So I'm gonna pause here and happy to take any questions there might be.
Thank you so much, Dr. Myron. I come from a technology background, and this entire intersection is something of fascination, not just for people who are technology nerds, but for everyone, because health is one domain which has very wide implications, from everyone in this call to all the attendees to everyone who might leverage from the Saath system. Thank you, Myral, for spending light on the future of technology and public health. Going forward, our next speaker is also very precious and special to the entire project of Saath. I remember hearing about her when we began the project around 8 months back, discussing about the project. And now she is here with us. I'm meeting her for the first time, Ms. Auret Sesri. Auret Sesri ji has been a key leader in the AXA group, and she works as the executive committee on AXA France, and was part of was the chief investment officer of AXA France for 6 years. As a graduate from NSI, she is also a member of the Institute of French Actuaries, and we welcome her to today's discussion. And she's going to talk about the role of CSR in creating social impact and how AXA Group has been leading on this front. Look forward to listening.
Thank you. Thank you very much for giving me the opportunity to talk in such an honorable panel and such a brilliant audience. AXA has a strong conviction about social impact of insurance. It has been our driver since a long time, and it crosses all insurance lines. We've built initiatives across many countries to bring affordable insurance to most vulnerable populations. And it is our mission as a major insurance company to contribute positively to society. We want to make insurance as inclusive as possible. Inclusion meaning insurance to most vulnerable populations, insurance to all categories and all geographies we can reach. There are many ways of achieving it, among which making sure that insurance products are really fit to needs by having a deep understanding of people's situations and constraints, bringing coverage in the most critical moments for people, giving access to most relevant information, and finding ways to broaden the access to as many people as possible. CSR in India is a fantastic tool to contribute to very impactful initiatives. And we are very happy to be part of this Saath initiative. Health has always been a high priority for AXA in all geographies. Launching the supportive action across telemedicine and healthcare initiative, Saath, with its innovative telemedicine service, maximizes the impact in several ways. First, of course, it gives free access to a doctor in a remote way with qualified doctors and now even specialists, allowing people to take care of themselves and their family from home, which is even more impactful in times of COVID, when moving to find the appropriate healthcare structure is so difficult and sometimes quite scary. The impact of this initiative after only 5 months is already very high. We had more than 30,000 calls, and we've been starting with 150 calls per day, and we are now at more than 400. Thanks to SIWA and the permanent improvement process of this platform, we are adapting to people's needs. For example, we are adapting our calls, hours, adding a female doctor to allow some people to feel more comfortable, and now adding several specialist doctors which is very important and will address much more needs than before. It has already had significant social impact in the 4 states that we are covering: Haryana, Delhi, Maharashtra, and Rajasthan. And the platform is taking calls from other states as well. We have very emotional stories about lives saved, people rescued, thanks to this initiative. And we are very proud of that, of course. Saath initiative has increased awareness and built trust in telemedicine in India. And trust is very, very important for telemedicine to make progress. And when COVID, hopefully, will give us some relief, we hope this new access to healthcare will expand further and stand as a usual one for all people in India. Thank you very much for your attention. And thank you for allowing me to participate into this wonderful panel.
Thank you, Ms. Adet. You mentioned something very nice in the conversation when you mentioned about the providing access to people who might not have it. And our next speaker has worked and dedicated his entire life for such a cause. Dr. Dhananjay Sakdevji is a Padma Shri awardee in the country of India, and he has dedicated his entire life working with the tribals in the district in northern Kerala, trying to create a chain of dedicated health volunteers called Arogya Mitras, and working with them and trying to deliver good quality healthcare in the remotest areas and ensuring that they get the best of the service. We have a pleasure to having you, Dr. Dhananjay, and we look forward to listening to your perspectives on how grassroots public healthcare defines itself.
Namaste. To start with, I congratulate Seva International to have launched the Saath telemedicine service with EXA. It is need of the hour to solve these public health problems in remote areas of India. In the initial discussion or speeches by Dr. Paul and Dr. Mayawar, they have given a very nice account of need of the telemedicine, the technology involved, and how it can be done. Here, I will like what practical solution is needed for the public health in remote tribal areas, so that telemedicine can be a part of the health package which is needed in this area where the access to health is very poor. So practical points what we are doing here will be useful for discussion level, so that the approach to the health, solving the health problems of this disadvantaged society will be there. Bharat has made significant advances in health of its population for more than a decade now, but there is a huge gap between urban and rural health access. And unless all people take initiative and try to have a new, strong, comprehensive healthcare system, it is important that the access to the health and quality of primary health care is improved for our remote areas. When we say about their health, it has been suggested that family-centered system is a good model. The doctors, paramedical staff, the local workers, everything work together, and then that family atmosphere is created, just like Dr. Paul was saying about the doctor-patient relationship. That is very important in this setup, so that all the government and the other NGOs, they work together to help this disadvantaged society. In short, I will narrate what Swami Vivekananda Medical Mission is doing in this tribal district of Wayanad for last 50 years. That can be the strategy or model for what can be done in practical ways in these backward areas where the healthcare facilities and other facilities are very poor. Swami Vivekananda Medical Mission is having 5-point program to solve this health problems of Wayanad. That is either tribal area, nearly 2 lakhs population of this district is tribal. They stay in remote areas, inside deep in forest, where there are no health facilities, no transport, no education facilities, and they are actually there is no communication between the people who are staying in remote areas and the day-to-day life of the normal population. So that gap has to be filled. So this to fill this gap and bring them to mainstream and help them in their day-to-day life. The medical mission is having this 5-point program. One is base hospital at Buttil. Second, specialist health schemes. Second is mobile. Third is mobile medical unit. Next is Swasthya Mitra scheme and this telemedicine. In base hospital, we have got 35-bedded hospital with all the minimum facilities, having X-ray, ECG, and we can admit patients. The aim was that we don't have a big hospital, vertical growth. We go horizontally and reach out to the tribal areas so that the health reaches to them. So for that, we started mobile medical unit. Our mobile medical unit goes to the remote distant places, and nearly 400 medical camps are conducted per year and taking health to the doorsteps of the needy. To arrange these medical camps and help our tribal population, we have got this Swasthya Mitra, that is health worker scheme. We have trained nearly more than 150 tribal health workers. We call them Swasthya Mitra in remote tribal colonies. They are the youth who are selected from the local tribal population. They are given training about health and about health education and day-to-day what can be done as a first aid. They are given a first aid box. They stay with their community, look after their health, visit colonies daily and give them first aid for any illnesses. And if they seriously ill patients are referred to our hospital for further treatment. So with the help of Swasthya Mitra, it will be very nice in future also. He will be our main contact point in these remote areas where when we develop the telemedicine facilities fully, he will be the center of the activity who connect between our base hospital, mobile medical unit, and the last mile patient, tribal patient or patients who are residing in remote areas. What we just now are doing, they carry having this mobile phones have been given to this Swasthya Mitras, and when the patients are there in their colonies, they are talking with our doctors in our hospital, and first hand information about the patients is being transmitted so that doctor can give advice to the Swasthya Mitra in who will help the patient, and if treatment is necessary, medicines are prescribed, or otherwise our vehicle goes there and the patient is brought to the hospital. So that is what we are thinking, that this mobile medical unit also, if we can have a better telemedicine facility, so that because there is in the rural areas, in Wayanad also and other, our doctor scarcity and paramedical staff scarcity is very high. So the mobile medical, nowadays doctors is going with paramedical staff. In future, if telemedicine services are improved, then the mobile medical unit can go to the remote areas with all the telemedicine facilities, so that in locally all the tests can be done and a minimum examination can be done of the patient, and then all this data is transmitted or communicated with the doctor who is sitting in the hospital, so that he can see the hospital also and give his services to the tribal or remote areas also. So that way this telemedicine facility, if is improvised, then so many sub-centers can be opened in so many areas where, because in remote tribal areas, the transport facility is very poor. Sometimes the in our Wayanad, it is a forest area. The people might have heard about this Nilgiri biosphere. There are tigers, elephants, and wild animals are there. And so many tribals are residing deep inside the forest, where there is literally no communication, no phone facility, no transport. So even if some patient is there, it is very difficult for him to go to the hospital or consult a doctor. Second will be socio-economic also. Going to hospital itself is a one-day program. So he will forego his day-to-day daily wages also. And because of transport facilities, and if the patient is seriously ill, then it is very difficult for him to go to hospital, which is very far off. So this type of, if we develop some sort of telemedicine system, mobile medical unit, and go there regularly and meet them and solve their problem day to day, then it will be very useful. Telemedicine can be useful actually for our small illnesses, day-to-day illnesses, and then follow-up of the chronic patients. And if there is serious patients are found, then they will be referred to the big hospital. So in this way, the telemedicine system is very helpful in this our rural areas. Because in rural areas, the main problems is that there is geographic isolation, then lower socioeconomic status, high rate of health related other behavior problems, then limited access to health. So with the help of Seva International and other NGOs and medical mission, if we can develop this Saath and telemedicine facilities, then it will go a long way. And this can be done in all the remote and tribal areas, especially where there is no access to the health facilities, transport problem, and deep interior areas. Main sometimes problem will be this technologically also, that the connectivity problem will be there, but that can be solved slowly. So I hope that Seva International will take all this initiative and do further actions, which is Saath with telemedicine, to help in this our remote areas of tribal areas. Thank you.
Thank you, Dr. Dhananjay. If you look at the three pillars on which Saath stands, it is access, awareness, and acceptance. And Dr. Dhananjay's message and Dr. Dhananjay's experience talked about all three on what he has faced from the ground. Access to quality healthcare, awareness that I need to go to see a doctor, and awareness that there is a problem that I need to understand and take proper medical advice, and broadly acceptance that such a solution is good for me, and accepting it and using it in a day-to-day life, as Dr. Dhananjay mentioned. Thank you, Dr. Dhananjay, for bringing this to life. And moving on to the session, we have a very special and one of the core members of this entire initiative, Mr. Ankur Nijavanji. Ankurji has been spearheading this entire discussions and the entire movement of Saath for the last 8-9 months, from ideating this to bringing various features to also launching and being a part of all the events that have happened so far. Look forward to listening to you, Mr. Ankur, and your discussions.
Thanks, Shubham. Thank you, Dr. Vinod Paul, sir, for inaugurating this, and Alfred for taking time out for this inauguration. Hearing all the speakers, I think one confirmation I have, we're on the right track. When we started this project, we thought that this will be more like a COVID helpline. And we thought that this will be for some time. We'll try to link ambulance and other support services. And Seva has done exemplary work in the COVID times. And as an insurance industry, you can maybe fund a few things, but I think the expertise is what we want to bring together. And once the concept of virtual care, which telemedicine is the key pillar, has come across, I think we thought that this is one place we should together as EXA try to work with a partner which is very well networked on the ground and very passionate. So we're very happy and proud to partner Seva International with this. Thank you, Shyamji, Nishan. Then the team led by Shubham, Fagun, Upendra, Divya, all of these guys who have worked very hard to publicize and work on this. And also our technology partners, Hops, and now we also have Rima from Hops, and we also have now Karkiros, who is also joining us on this thing. This project has evolved on ground feedback. I think what Dr. Paul, taking into account what you had mentioned, we have focused on feedback, and the feedback, whether you put a female caller, you put a local language caller, Some feedback comes from ground, some feedback comes from the people who call. This project has evolved into now launching specialist services. The specialist services we are offering are ortho, gynecology, pediatrics, dermatology, and we are now able to offer cancer also, especially towards cancer detection. That's something I think is a big issue that has not got that much focus the way it should. And I hope that going forward that we'll be able to add more specialties based on the ground feedback and take it to more states. We have a very young team, both at Seva and at our end, Ritika, Kritika, Saurabh, all working on it, and at the Seva end also. And so we believe that together we should also, we'll be focusing on one more area, which is primary care. India, primary care from the insurance sector, we have not supported much. Very honest, we have not supported at all. We have been focused on secondary and tertiary. That's where we make money because we're comfortable with it. But the need of the hour is primary care. And if you have to offer primary care, what comes in primary care is outpatient insurance, it's vision insurance, dental insurance, maybe mental health. I believe that once you have comfort with telemedicine, and we plan to also launch an app where people can order medicines and diagnostics tests at their home, and people are comfortable with this. As a sector, this project would give confidence to the insurance industry also to focus a lot more in terms of offering solutions for the primary care. The solutions, I think, for primary care would be hybrid and will have to be with various implementation partners. Could be NGOs, could be research institutions. But together, I think the next focus for this project would be focusing more on the primary care and prevention part. I'm really thankful for all my team, and I would say Seva team is also our team. I think they work very hard on this, and I hope this thing keeps on evolving, and we would request everyone to give us feedback. I think the most critical part is feedback, because what you tell us, that will help us evolve. We can't be perfect. We'll be making lot of mistakes. So like some suggestions have come from Dr. Paul, some from Dr. Anurag, Mr. Hanjay. So it's good. Please, we'll be very happy to connect outside this. We believe this project has to go beyond telemedicine. It has to connect with ground units, the mobile van you're mentioning, and other ground facilities. This all has to be connected into an ecosystem. And we are planning it together with Seva to maybe hold a conference very soon to see how this project can evolve in the next 6 months. Because we don't want to run this initiative for a limited period. We would like this to continue with something that's more long-term and impactful on the ground. So we expect that all of you to help us navigate this journey and guide us on this. Thank you.
Thank you so much, Ankarji. He has not just talked about the domain that we are currently working on, but also laid ground for the future. And that's the role of a true leader of any project. Thank you, Ankar sir, for guiding our way. Our next speaker, Dr. Sanjay Rai, is not a new face for any one of us. Whoever has been following the COVID-19 pandemic has seen Dr. Sanjay talk about the vaccination, the issues that come with either any of the variations. And he has been one of the most known faces of quality medical advice that we all have looked up to. For me, it's my first direct interaction with him. But I have heard him so many times via his videos on YouTube or via various news channels. It's a pleasure to have you, Dr. Sanjay, over here to shed light on the future of telemedicine. Thank you.
Thank you, Mr. Kumar Subham. And thank you very much. And namaskar, all the dignitaries, my senior colleague, Dr. V.K. Paul, and Dr. Alfred, and Dr. Syam, Dr. Anurag, Dr. Dhananjay, and all other dignitaries, ladies and gentlemen, those who are attending this webinar. First of all, I would like to thank Seva International for having me here and provide an opportunity to interact with all of you. I also congratulate Seva International for this launch of specialist telemedicine services. Mr. Kumar, I know that time constraint, we are already behind the schedule, and all the previous speakers, they have already covered many things. So definitely I'm not going to repeat, but there are challenges. So I will focus my talk on challenges, and so that we can prepare ourselves better for any future challenges. We all know that during COVID-19 pandemic and the result of ordering this type of social distancing, etc., the various preventive measures, telemedicine came into the mainstream during this time, and that time we realized the really importance of telemedicine, how telemedicine is important for us, especially during this time. Like that time we didn't have legal framework for this, and as Dr. V.K. Paul, he highlighted that they released very timely this ethical guidelines on telemedicine, and that was the need of the hour that time. And if I recall correctly, that was released on the same day when the lockdown was implemented, and that was the 25th of March 2020, the same day. So this way I recall the dates. So the same day there, and that was really a nice guideline. If you go through the guidelines, so there are advantages, disadvantages of this, all this. So there are no doubt many advantages. Like in current scenario, if you see how to improve our this healthcare delivery system, so there are two ways. Either we can go to the community, or they can come to us. So the current model is they are coming to us. That us means a healthcare system, healthcare delivery system. This is, so it's our moral responsibility and social responsibility of government to provide accessible, affordable, and quality care. Many people we know, the especially the poor or poorest, they can't afford to travel every time for a quality care to a tertiary level hospital like AIIMS. And that is not always needed also. Many times we do not need this type of unnecessary travel, and that can be avoided. And all the previous speakers, they highlighted all this. So I'm not going to cover this, but definitely that will help this type of consultation, telemedicine, using our information and communication technology in the follow-up consultation. Many times, really, a physician do not need the personal appearance of the patient. Many times they need just a few investigation, like suppose a diabetic mellitus patient, after diagnosis and a patient is on treatment, so they require a follow-up, a 3-month, 6-month follow-up, and just to see the reports, they require all this follow-up, like blood sugar level, SbA1c, kidney function test, etc. All this. So just to change, either to continue the same treatment or to change, to increase or decrease the this. So just I'm giving you example. So many times these patients do not require to travel from remotest area of Jharkhand to AIIMS New Delhi, but they are traveling. The fact is they are traveling, so that can be avoided, and so this will be a win-win situation for both healthcare system, not only healthcare system, and also for the patient also. But there are some challenges also. I will focus challenges. Almost everybody discussed about the benefit of, no doubt, we have huge benefit, and the challenges is very less if you compare the benefits. But there are challenges, like sometimes it may happen that information provided through telemedicine may be misunderstood and misinterpreted by patient, and that may cause some problem. Data privacy and confidentiality is of definitely utmost importance. So how to maintain this should be an important area. And there is a need to develop a process for reimbursement of the services. Many people, they require the reimbursement of the services, like for physical appearance. If they are registered patient to a hospital, then that task is easy. But for this type of reimbursement, like those who were in the government servant, now they are the retired servant, or and they were in the private, and then there is a provision of reimbursement. So how we'll do the reimbursement? And then Dr. Dhananjay, they discussed about the internet. Definitely high-speed internet connection, although Government of India is progressing very fast to provide the high net internet connection even at the rural level, but this could be a challenge for especially for the rural patients. Logistic, patient access to software, and then the trained staff, those suppose if you are strengthening our primary or secondary health system to providing this type of services. So this could be provided through either strengthening services. Patient can go there, right? And then with the fixed centers near his or her home, and then we can provide the consultation to the from a tertiary level hospitals. So even at the primary level hospital, that can be provided. There is some issue of financial gain, misuse of this type of. So this is also an area. So we must be conscious about this. So during this COVID-19 times, telemedicine had flourished in India, no doubt, all over. If you even in AIMS, we started this telemedicine consultation, and that was very helpful for the patient. And definitely, it's a good option to manage patients who are diagnosed for a disease and under regular treatment. But for new patient, again, that will be a challenge. So I can say if telemedicine is no doubt future of this country, for all developing countries and for entire world. So this telemedicine provides the ability to transform care from being this practice-centric, where patient and families must adhere to the your clinic schedule and physical location, to the patient-centric by decreasing travel and like many missed school or work, etc. So that will not happen. So really, I congratulate Seva Bharati for a great initiative, but lots of things to be done. I can say that the future is of telemedicine. So thank you very much. Thank you very much for patience listening.
Thank you so much, Sanjay ji. In the entire discussion, there have been a constant theme of empathy and caregiving. The entire idea of connecting with the last mile and at the same time connecting with the experts so that the last mile gets the help and support of the experts has been a constant theme throughout the discussion. And one person I have seen from the day of the launch on 17th September in Central Delhi and throughout has been constantly concerned on what are we doing for the community has been Derek sir. When we first interacted at the end of the launch function, he asked me, what do you feel about the service? And in the last review meeting, he asked me, which areas are we currently working on? And do we really need to go any further directly connecting with the community? He has been the leader of EXI Excel in India and has been very passionate about CSR projects across. So I just request Derek sir to summarize the entire discussion and share his views on the service.
Great, thank you, thank you, Shivam. I'm very conscious of the time, and I would love to do a summary, really, of all the speakers, but I don't think I have the time. But what I do want to do is to thank all our distinguished guests and the excellent speakers, and to Shivam and the Seva team, because I think you pulled together an excellent set of speakers, a great agenda to help us with the launch of our specialty services. I guess I can't go into a lot of detail, but just to say I certainly endorse the comments made by my colleague Ankur around how this program has developed. It was great to hear from Dr. Paul, who talked about the governance, the benefits, and the potential of telemedicine, but equally he also gave us some points of advice around customer service, around having the same doctor, about the point about getting the right standard of service. And I can assure Dr. Paul that we will take on board that feedback. If there's something I think that has been a thread all along this project, has been the fact that we've listened to feedback and we're on the constant sort of journey to improve the service. So without taking too much time, I do want to say, I want to thank all our partners. I want to thank all the AXA businesses, the CEWA team, the government officials, everyone who's working hard on this project. I think we also heard from one of the speakers that what we've embarked on is not easy. But I think with the commitment and the will of all the teams together, we can see already after 5 months that we have made inroads, we have seen successes, we are constantly improving. And I think that with everyone continue to collaborate like this, I'm sure we can take this telemedicine service into the next level. So really a big thank you from me to all the supporters, to all the speakers today, and to Siva, of course, who are central to all this, and all our AXA colleagues who've got lots of commitment. And I think while we talk about 13,000 users so far, we all know the potential. And I think I would ask all our partners and every one of us here to see how we can really leverage this great service and how we drive the potential to far greater numbers. So thank you, everyone, and best of luck, I guess, to all of us.
Thank you so much, Director. I request Shyamji to just end the session with thank you note to all.
Okay.
Shyamji.
All right. Just a minute. Namaste. I am glad that today's program turned out to be one of the best programs that we did conduct. And the resources who guided us through today have been very valuable for us. And in the journey of Saath that is being carried out by Seva International AXA Group together, this is a remarkable milestone. And I thank you all for attending this, especially the Honorable Member of the Niti Aayog, Dr. V.K. Paul, Dr. Sanjay Rai from All India Medical Sciences, Dr. Anurag Mairalji, who had been guiding us all through the COVID times from California, Stanford University, Dr. Dhananjay Sakdev, the Padma Shri awardee, who has been associated with Seva International activity for long. Of course, the AXA team led by Sri Arjun Nishavanji, the CEO, and of the team from France, Sri Derek Najaretji, head of the global operations and country head, Ms. Orette Cesari, head of the business development at AXA, and Dr. Alfred Bale, Chief Medical Officer of the AXA. So I thank you all for joining, taking out your time amongst the busy schedule. And I thank the audience for joining this. Thank you very much and namaste.
Thank you, everyone.
Thank you, everyone. Thank you and namaskar.
Thank you. Namaste.